Good morning, folks, and thank you so much for joining us. We are thrilled to host our child advocacy panel discussion today. My name is Stephen Warner, and I have the privilege of serving as Executive Director for Voices for Alabama's Children. On behalf of the Voices team here in Montgomery and our Board of Directors across the state, we are thrilled to host today. Typically, our Child Advocacy Day has been a breakfast. It has been limited to the folks that fit in the room, and so this platform is allowing us 500 folks to join us. This has been the largest advocacy event we've done to date. We're really excited about it. I can speak on our behalf that 2020 has not been the year we expected. It has been challenging, to say the least, but as a team, as a family, and for our state and our nation. We recognize that this event, which typically happens during session, was going to be difficult to do, given that session was the strangest session in probably Alabama history. We appreciate the leadership on the part of the legislature, and we were excited to hear from a variety of folks. In addition, the state agencies that serve our children have been stretched beyond anything they've experienced before. The challenges facing our state are unique, and we are in trying times. So if you'd asked me beginning of this year what was going to be our biggest challenge in 2020, I would have told you the census. Voices has worked very heavily over the last almost 2 years to help make sure that every child gets counted in Alabama and that we get the best count we can. That is still a tremendous priority, but larger issues have arisen clearly. So we are excited today to hear from a variety of speakers, state agency heads, our budget chairs from both the House and the Senate. But we wanted to start today with an update from ADECA on the state of the census in Alabama. To that end, I wanted to give Mike Presley a few minutes, and he'll be joining me shortly to give us a brief update about where Alabama is on the part of the 2020 census, what the plan is, and what we're doing. So, Mike, I will turn it over to you.
Okay. Everyone's doing well, and just want to add my thanks to you, Stephen, for allowing me this chance to share with everyone kind of where we are on the census, and want to thank Voices for their continued partnership throughout this process. So as you said, I think to say that 2020 isn't what we expected is probably an understatement, and that includes the census. COVID has certainly presented a lot of challenges, but we still remain optimistic that with some extensions and some different things going on, we can still achieve a successful count. So want to kind of just take a few minutes to tell everyone kind of where we are, where we've been, and then talk a little bit about where we're heading and some date changes and shifts, and then finally, and most importantly, ask for your help. So as of June 16th, the state is at a 59.3 self-participation rate in the census. So that includes people who have self-responded. They have filled out the form online, by phone, or by mailing in their paper form. So that is about 2 points below the national average. In the Southeast, we are pacing pretty well. We're ahead of Florida and Texas, but we are certainly not where we want to be. And we need to do better and need your help. Just a reminder of why it's important. It's our once in 10 years opportunity to improve the future of our state, and our children really need us to come through, because so much of the funding for these federal programs that children and families depend on is derived from census data. So the more people we have participate in Alabama, the better off we'll be in securing our fair share of that critical federal funding. And that's funding is about $13 billion per year that comes into the state from the federal government, and none of us want to lose that. Also at stake is representation. So we are at risk if we participate like we did in 2010 with a 72% overall rate. We're at risk of losing a congressional seat. And I think everyone saw the importance of full representation with the CARES Act that was passed a few weeks ago in Congress. We hate to think if Alabama didn't have a full complement of voices advocating for our state's needs and our state's children's needs through that. So that really underscores the importance of full and adequate representation. So it's so important that we continue to encourage everyone to fill out the census. Now, as I said earlier, COVID has definitely made a big impact. We had a big statewide kickoff event on March 12th and had a lot of events kind of planned for the weeks after. And I think March 13th, the next day was the day that the first COVID case was confirmed in Alabama. And that afternoon is when Governor Ivey and Dr. Mackey decided to have school move to a virtual environment. So really, census has kind of lived in the shadow of coronavirus ever since. And as I said, it has kind of just affected a lot of in-person events and outreach that we had planned because of the restrictions, because of the social distancing. We've had to alter that to more of a digital environment, much like this conference here today. So we've had to do things on social media. We've had to rely on phone banking. We've done a lot of media interviews remotely. But we're trying to do everything we can to continue to get the word out that the census is still going on. It's still important. Now, let me talk a little bit about the Census Bureau's operations. So certainly this is not something unique to Alabama, so it's affecting the whole nation. And as a result, the Census Bureau has adjusted some of their operational deadlines. Back in March, they did suspend operations in Alabama, but as part of that, they extended the deadline for census responses. The original deadline was July 31st. That has now been extended to October 31st. So it gives us 3 extra months, to encourage people, Alabamians, to fill out their census. So we still have time. It's not too late. The Census Bureau also, as part of that, has set mid-August as their goal for starting what we call door knocking. So this is if a household has not returned their census form by mid-August, the Census Bureau has hired temporary workers, and those workers will go out and knock on the doors and attempt to get a census response from those households. Now, the workers will, obviously, we live in a different day and time now than we did in early March. So they're being trained and being equipped with the appropriate personal protective equipment, and they will follow all social distancing guidelines and have protocols in place to protect both the employees and the households they visit. One of the things that they have been working on in the last few weeks is households that received their mail through P.O. Box. Their census invitation and packet were hand delivered. Now that was delayed in March when COVID hit, but they have resumed that operation in early May. So a lot of those areas, a lot of rural areas where the households just receive mail by P.O. Box, they have finally gotten those invitations and are responding now. So we're pleased at that. Now, right now at the state level with the DECA and Alabama counts, we're working on a sort of a reboot plan with this extra 3 months we have. And we've shifted focus a little bit to reaching people more in their homes, but as conditions change, and that's the key word, we've tried to be flexible, because what's going on now might not be what's going on in a few months. So we're trying to adapt to ways that we can get out on the road a little bit, but also where we can do things like text messaging, more social media, virtual town hall events, that kind of thing. So, we'll be putting out more information on that in the near future. And finally, just wanted to ask, we need your help. You are trusted voices to the children and families that you serve. And we found throughout this whole process that that's the most effective way to reach people and to help them feel comfortable filling out the census. There's a lot of maybe hesitation because it's the federal government asking for information, and a lot of maybe apathy. People don't know why it's important. But the census has never been simpler. The basic demographic questions, they ask no financial information. And the information takes about 6 minutes. The information that you put on the census cannot be shared with any other federal or state agency. It does not affect eligibility or participation in any kind of benefit programs like SNAP or anything like that. So it does not affect eligibility at all in that. But we really need your help as influencers just to talk about the census to those around you. Everybody kind of has a sphere of influence, whether it's professionally or personally. So we just encourage everyone just to, when you're talking to people in groups or individually, just take a few minutes and say, hey, have you filled out your census? It's important to the state. And also, everybody, I think today has an iPhone or a smartphone, and most people text, and that's another powerful way you could reach people and encourage them to fill out the census. And all you have to do is just tell them to go to my2020census.gov. That's where you fill it out online. Or there's a toll-free number, 844-330-2020. 844-330-2020, that if they don't feel comfortable online, they can call, and a Census Bureau worker will take their information over the phone, or they can ask any questions they would like. You can also return your paper form. So that pretty much concludes my update. Just want to, again, thank you, Stephen and Voices, for the opportunity to share. And I know that COVID has posed a challenge to pretty much all aspects of Alabama, but I know together we can succeed with the census and secure a brighter future for our children. So thank you, Stephen.
Okay. To go back and cover some housekeeping issues, please use the chat box. That is how we are collecting questions. With most of our presenters, we will have a Q&A session. We are monitoring that chat. So if you have questions, please post them in. We will also be recording all of those questions. If there are any of those questions that we do not get to due to time constraints, we will be sharing those with the state departments and hopefully collecting answers. Additionally, this webinar is being recorded. As anyone who is registered for it will get a link to the full recording at the end of the presentation. So you can rewatch, go back and dig into any questions that you had. So this is being recorded. We will be sharing it out. If you have any issues with sound or video, we encourage you to try refreshing your browser first. Also, internet connectivity issues can cause problems. So first answer is try refreshing if you're not hearing or seeing something. If there are stutters and hiccups in the video or the sound, please recognize that we are all trying to make web-based conferences work as well as possible, and the technology has its hiccups. So thank you for your patience on that. Additionally, if there are any resources or presentations that will be presented and shared, you're going to see those pop up on the right-hand side. So if we will be doing polls throughout the day. We'll be sharing resources. The team here will be uploading the files or any data points. They'll be posting those in the chat. And so please feel free to download any of the resources or click through to the links. Those will be in the chat. With that, I'm ready to move forward. I appreciate, again, Mike joining us from ADECA. We are fortunate today and very appreciative of both of our Education Trust Fund budget chairs. Senator Arthur Orr and Representative Bill Poole will be joining us today to discuss the state of the budget, what revenue looks like moving forward in the next year, and what we can expect. So I'll start off with Senator Orr, who wants to talk from his perspective and then share a little bit about some of the line items that have been of particular interest. So Senator Orr, thank you so much for joining us today.
Thank you. Good to be with you all. And I guess what I thought I would do rather briefly was walk through some important provisions of the budget. But before I do that, two things. One, just want to compliment Voices for all you do for children around the state. and your work and your efforts. I read your literature, some of it very thick and voluminous, but it is very important, and appreciate the job that you do. The other thing is you're going to hear from Chairman Bill Poole from the House of Representatives, and just want to compliment him and his committee for the good job that they did in a very difficult time where we started off, as you mentioned earlier, we started off, you were thinking about the census, and we were thinking we had several million, $100 million more dollars in Governor Kay Ivey's budget proposal to deal with than the reality that set in March and April. We decided to do much less than that. We are one of the few states in the country that actually expanded our budget for fiscal 21 to a new high. And that is because, again, I think the fiscal discipline, your members have probably heard of the Rolling Reserve Act that forces us to save and not just spend to the revenue estimates as had been the practice, and then paying on the back end via proration when we overshot our revenue estimate. So because of that fiscal discipline, we were in pretty good shape, knock on wood, very hardly, because we don't know what the future holds as far as the virus and what the revenues will be in October, November, and if we have a relapse. But we think that we provided for that. But all that said, a lot of compliments to Chairman Poole, who will back cleanup, of course, addressing the things that I may gloss over or miss that he thinks are important for your members to know about. A few things, these are just line items that I believe are relevant. One thing that increased substantially, 50% or so, is child abuse and neglect. I know the House had very strong opinions about the money that goes out around the state in the form of grants to nonprofits dealing with children, and 50% increase, very healthy year over year, and certainly a good thing for nonprofits around the state that deal with children. More money for dual enrollment to help those in high schools to be able to start accessing college classes while they're in high school, free of charge. And so that's certainly an important thing. One of the things Chairman Poole and I discussed was, scholarships, and for those in the medical practice who would commit to practicing in rural areas. So we instituted, the House put in a line item for dental scholarships. We had been solicited to try to get dentists around the state. And so this was something that we felt important to start. Pre-K had a $6 million between the two fiscal years increase. That I forget how many classrooms that was, but it's to keep that ball moving forward. There was a concern, well, if the virus does come back, are we going to be able to deliver those services in the pre-K setting, having those very young children come into that environment? And we didn't want to get started and then have to shut it down all in November, let's say. So we it was a maintenance year, small increase, but something important. One of the things that came out of the Senate was trying to address an initiative being done across the state to prepare parents for the role of teacher if they have to teach their children going forward with another shutdown. If the children are sent home and it's going to be a distance learning environment, a lot of parents aren't prepared for that. So Senator Figures in the Senate brought this to our attention, and that's something that we put an appropriation in there. It was being worked on by a collaboration of agencies and nonprofits, but help with marketing that to parents. So the net is have a website where parents can go to not only find out about services for children, but also how to coach or become a teacher with classroom instruction that's not going to be incurring due to the virus and due to everyone being sent home. The Another thing that the House, and again, compliment them, thought was very important was an increase in school nurses. Chairman Poole will probably talk about the rationale behind that, but certainly something very important. One of the main movers this year is because of as a result of the Literacy Act, which focuses on early grade reading. And we saw in the coming year an $19 million increase. Then we had a supplemental for the current year that we're in of around $10 million increase, all for early grade reading and this is a bill that was sponsored by Representative Terry Collins to provide a lot of services to children in the early grades, first through third, to make sure they're able to read when they leave the third grade. And it's just a very important legislation for our state, just to have that done. And so now we have to put our monies where our mouth was, and support the training for all the educators. So working with Dr. Mackey, this is something that the legislature really, $30 million between the two fiscal years roughly, to make happen. Another thing that I hope Chairman Poole will elaborate on, because his member, Representative Nathaniel Ledbetter, took a leadership role in this, is mental health counseling. You saw about $6 million new line items being spent on that for children in K-12 to help with mental health issues in the K-12 system. So I'm sure he'll have more comments about that. Going forward, something that is more important, and we talked about this last year, Stephen, was ELL. Kudos to Superintendent Mackey for starting this, and then the governor, in her recommendation, we almost doubled the funding for English language learner funding across the state to help these children learn how to speak English and write English and communicate in English, because it's so important to be able to pass the national standardized test and to lead productive lives here in our state. So really, again, putting our money where our mouths were and getting serious about that funding. Governor Ivey did something that I thought was significant. We had funded around $2 to $3 million for the high needs special education students. She took that number and ran it way up. You had to bring it back down because of the budget cut being reduced about 75% as far as the growth, from about 400 million down to about 100 million, 90 million. But we left a 9 million plus amount in there for these high needs special ed students, help local school systems with those very unique children who need significant funding. A few other things, and I'll wind up. We had increases for to help with children's safety in youth sports programs. That was a new line item. They saw a lot of risk coming to the children there. Gifted students, it was something that we increased to focus on those children. There was also a focus on trying to help rural health initiatives and college scholarships. So all that to say, I think we did a good job in the budget, given the topsy-turvy world we were in. And as I said at the outset, I'm sure Chairman Poole will have cleanup comments to further enlighten the viewers today as to particular details or the macro as far as the overall budget numbers and the split and things like that.
To Representative Poole, and then we'll save any questions for the end of this section for coming from the chat. So Representative Poole, you are up, and thank you, Senator Orr. And bear with us as we get the technology working. So coming from the chat, the additional $6 million for pre-K added an additional 56 classrooms this year. And I know they had over 100 applications, so we were definitely going to be able to fill those out.
Thank you, Stephen. Appreciate you having me. And good morning, everybody. Can you hear me? Thank you, Stephen. Appreciate you having me. And great. Good morning, everybody.
Well,
Can you hear me? I want to thank everybody, Stephen. Okay, great. Well, again, I want to thank everybody,
And there we
Stephen
are.
Voices, for the
Representative,
opportunity
good to
this
see you this
morning.
morning.
Just a couple kind of initial comments. One, want to echo everything, and second,
Okay.
and emphasize everything that Mike with ADECA said about the census. Obviously, that's critical for our state, and it's going to take the contribution of everybody to get those participation rates up. So I want to endorse everything that Mike said and urge everybody to please assist in every way possible in that regard. Also want to thank and echo Chairman Orr for his comments and his work on this budget and in prior years. I think this is a good budget. I think it was a fun budget to work on in the sense of, we had a lot of challenges, but the governor had a number of priorities that I thought were well thought out and well conceived. The Senate and Chairman Orr had some priorities that we all certainly endorsed and agreed with, and I think the House had some priorities. So under the circumstances, I'm very pleased with the budget that was passed. And, just to maybe provide a little bit of context, and Chairman Orr touched on this, but, we're incredibly unfortunate in Alabama that we increased our budget this year. And I know everybody on the call knows that, but via the Rolling Reserve Act and other budget decisions that have been made in recent years, we've seen increased investments in education and early grades and pre-K year over year in recent years. And despite the difficult times that we are in, we passed once again a historic budget level for the state of Alabama. And you're going to see states all over the country, and you're reading it, cutting 15, 20, 25% out of their budgets. And so we're fortunate to be in the position we are. I think that's a credit to some decisions that have occurred and a credit to the people of Alabama. So just to kind of talk about the budget a little bit, I think Chairman Orr touched on a lot of the highlights of the budget, and I know many of the participants on this call will be familiar with those. But we were, just kind of touch on raises and some other issues. We were disappointed to not be able to provide raises, but notwithstanding that, we were able to increase the FY21 budget over the 20 levels. Our decreased capacity as a consequence of concerns about the COVID impacted revenues obviously impacted a lot of investments. So raises were one of those, but we've invested in technology in recent years and sustained those. We've increased, once again, the investment in transportation, and that prevents local districts from having to divert local funding to transportation. We're almost 100% funded on transportation. And I know that doesn't seem to really relate to children's issues, but when the locals have to divert money for transportation, that siphons money away from these other priorities. The bond proposal should help our K-12 schools substantially address a number of capital and repair needs. So a lot of resources are out there. So there are a lot of challenges. We all know that. But I think I'm pleased from a resource standpoint that we've been able to really, really hit some needs and have some priorities. So, a couple things that Senator Orr touched on that I'll maybe expand upon is we're very pleased to increase funding for child abuse, neglect, and prevention. We all know families are struggling, children are struggling. There's a lot going on in the communities. Private donations may be down to nonprofits who are trying to support and fill gaps around our state and are doing a yeoman's job in that. So by providing more funding, substantial relative to current budget levels, very pleased in that, and I know that so many of our citizens rely on those services. Chairman Orr talked about school nurses and mental health, and I really want to credit and Chairman Orr recognize him, but Representative Nathaniel Ledbetter. In some meetings prior to the session, he volunteered with the governor and I and Chairman Orr and others discussing mental health issues in schools, which in my years of serving, I've never heard such a consistent and immediate cry for help from teachers across the board on the mental health issues in our schools. So he and others worked very hard on that, came forward with a proposal. We funded that proposal, and it's just a start. And we all know that. But we had to start, and even under these budget conditions and economic conditions, starting that was critical, and learning from it and expanding it. And so whatever the situation is in the fall and spring, I think those funds and those resources that will be brought to bear as a consequence of those funds will hopefully certainly be helpful. School nurses, obviously within the current context of the pandemic, any additional resources that we can provide to schools in terms of healthcare, school nurses, so on and so forth, was critical, going to continue to be critical. And want to give Representative Debbie Wood a lot of credit for her work on that issue. Our committee kind of met and tasked her with trying to work with a number of stakeholders to come forward with a concept that we could work with. We took that and ran with it in the House. The Senate sustained that, which we're very thankful for. They saw the need just like we did. And so we're very pleased to provide that additional funding. Certainly anticipate that it will be helpful in the coming academic year. Senator Orr touched on it, but I don't think we can talk about it enough. Is early grade reading and literature. And those of you that pay attention to Chairman Orr's committee and to the House Ways and Means Committee know that's been a constant theme in recent years. But the increased investments in the Literacy Act in prior year's budget, or current year's budget, I should say, and the next year's budget are significant. They far exceed $35 million in their totality of what the legislature just passed, inclusive of the supplementals. But I think everybody would agree, if we don't have children reading at third grade, we've just failed. And there's really no other way to address that. And we're not going to be successful, and we're not going to accomplish the things that we know we want to accomplish and need to accomplish unless and until that's the case. So very aggressive investments in literacy that really, substantially overshadowed all other investments in this budget. That was, our literacy investments were probably more than a quarter of the total new investment in the budget. So that is the primary point of emphasis. I think will continue to be so. And I would anticipate you'll see the legislature, who knows what the economic circumstances will be, but to the extent we have additional revenues for the FY 2022 budget, the next year, watch for us to move into the area of math for those early grades. Wanted to get reading under our belt, up and running, and then potentially pivot to math. But a couple comments on those two fronts, because I think we need the input and assistance and guidance and support of everybody that's participating in this call. But on the literacy front, we're all going to have to monitor and make sure those dollars are used wisely, with purpose, with a plan. We're tracking it, and we're accountable, and we're operating that leads us to an outcome we all desire. So it's going to be critical that we really, I think, monitor and oversight those investments to make sure it's working and working well. On math, we've got to have more math teachers. And I think you'll continue to hear a lot of discussion about that. But we can talk about math all day long. We need more math teachers. We need more teachers generally. And there were investments in this budget, once again, to market the profession of teaching, to scholarship math, science, and other STEM teachers that are coming out of our universities in terms of tuition forgiveness programs. So I think there's a lot out there that we've done, we've put in place, but that a lot of people don't know about in terms of the profession of teaching in regards to tuition forgiveness programs, stipend programs we've put in place. There are a lot of resources out there, but again, I don't think the word's gotten out on that. So hopefully some marketing and some advertising and some communications effort will help on that. But certainly hope everybody on this call will support and help on that. Chairman Orr talked about the ELL funding, so a very significant increase there. And there was really no, I know that was a priority for Chairman Orr in the Senate. It was also a priority in the House. You saw a very aggressive investment there without any pushback. And hopefully that will complement to the Literacy Act investments the early grade reading investments, the pre-K investments that we continue to make every year and prioritize, and potentially upcoming math investments. So I think those all fit together. So, I think I would, there are a lot of things I could talk about on this call. I think as we just summarize the budget, I think Chairman Orr touched on a lot of the highlights, but I think a point of emphasis that I have, and I think in my judgment it's important, is we have a lot of challenges right now, as a state, as a country, a lot of things going on. There's a lot of uncertainty, a lot of issues. In Alabama, we have an opportunity here, and we've got to view this as an opportunity. We have to be optimistic, and I think we should and we can be optimistic. We're increasing our resources. We're targeting our investments. We are focused like a laser on some of these fundamentals. And I think that's what's going to be critical right now, is the fundamental investments and then the follow through to support education, to support families, to support children, so that there's opportunity and there's equality of opportunity and there's an opportunity to be prosperous and successful in Alabama. And as our economy hopefully recovers and as people go back to work and our businesses resume, hopefully we'll sustain that, and that that the optimism will carry forward and the opportunity will carry forward. And that's going to take a lot more discussion and a lot more work. But I think it's important in these times to remember the work that's been done in Alabama. A lot of foundation, I think, exists. Now we've got to continue to build on it. So, despite the challenges, I hope that everybody remains optimistic. And, and I know Chairman Orr and I talk about this, but, we and everybody else are thankful for what everybody does to contribute. Everybody on this call, or in so many respects, are the true boots on the ground. And that's what it's going to take. And it's going to take more of it in order for us to continue to move forward. So I want to thank everybody on this call for your continued work, and look forward to not only questions on this call, but certainly working with everybody going forward.
Thank you so much, Chairman Poole. We have one quick question. It's a two-part question. One of them is, what do we foresee as the fiscal security over the next couple of years, 2-3 years? And then tied to that, what do we see as potential investments in early child, particularly the first teacher program, the home visiting program that reaches those 0 to 3 children, expanding. We don't invest what other states our size invest in that, and we know that it has significant impact. So two questions would be 2 to 3 years out.
Let you predict the revenues for the next 2 or 3 years.
What do we think is the opportunities for investments in early childhood, first teacher, home visiting programs?
Bill, you want to go first? Yeah, I was going to say, we don't have a crystal ball. So as Chairman Poole said, we've been very disciplined with the rolling reserve. So that's put us in pretty good shape. But if the economy falls, we'll go with it after a point. We'll have to start
I would echo
cutting,
Senator
and
Orr's
that would
comments.
not
I mean, we can
be
only
a choice,
control what
but
we
would
can
just be
control.
dictated by the revenue.
If there's a second, third wave of this, we will suffer.
So I'll let Chairman Poole answer the
state revenues will suffer. There will be so many challenges. But once again, as a consequence of the Rolling Reserve Act and other budget decisions, we'll be relatively better shape, I think, than many states to weather that storm. Notwithstanding, it could be difficult, and in worst case scenarios would involve reductions in spending and appropriations. So we certainly hope to avoid that, but we all know that there are no guarantees right now. But that's why some of the safeguards of the Rolling Reserve Act are in place. I mean, as we are here today, we still have a little over $300 million in the stabilization account. May make a small, we'll see if we're able to make a small deposit into that account at the end of this fiscal year. We held back other resources, and Chairman Orr and I talked a lot about that. We had to buffer ourselves against those worst case scenarios to the extent we could. But also want to note, we'll have those revenues. They're going to find their way. Those resources are going to find their way into education. They're going to be invested, but But as we navigate this uncertainty, it was important to hold some of those in abeyance so we can determine how to best utilize those resources in light of some of the uncertainty that surrounds us right now, and will continue for a while. As to the second question, that's a tough one to answer, as foreshadowed by the answer to the first question, which is it's difficult to foreshadow or forecast increased investments in anything right now in light of that very uncertainty we've discussed. Now, having said that, I think it's going to be critical that we continue to focus on fundamentals, particularly in times of uncertainty. And, as we're talking about K-3 reading and math, as we're talking about we're not 100% funded on the pre-K level, I think we've got to determine, until we're 100% funded at pre-K, how far below younger than pre-K can we stretch our resources, and to what return on that, while we're still trying to get to 100% on pre-K. So, I certainly don't have any preconceived notions or conclusions as to the proper balance there. But I think that's the fundamental question, is as we're trying to successfully address some of these other issues, at what point do we expand that focus, or what point do we stay laser focused? And I think there's room within those, but I think that's the discussion that everybody needs to be informed of. What are the pros and cons? What are the costs? What are the benefits? How much impact can the dollars have? How does that impact these other priorities that we're trying to accomplish? And I think that dictates the outcomes of those discussions.
So much for your time. It is an honor and privilege to hear from both of you, and we appreciate your hard work. On behalf of Alabama's children, it is so clear that y'all have prioritized.
Thank y'all. Thank you, Chairman
The
Orr.
kids. And on behalf of Voices and all of our advocates, thank you. We are going to move on, so we appreciate you, and we look forward to working with you in the months and years ahead. So thank you both, gentlemen.
Thanks.
So next up, I'm going to introduce the moderator for our panel discussion, which is going to be a very unusual panel discussion because we cannot put everyone on at the same time. And so we have Dr. Charles Nash joining us today. He is the Senior Vice Chancellor for the University of Alabama System. He has been a longtime advocate for children, and he is a recent member of the Voices Board of Directors. We appreciate his leadership, and we are going to turn it over to him to go through the panel discussion. I'll highlight who we have coming up just so you all know what we're looking for. We are going to start with, we're going to have Department of Education, we're going to have Department of Human Resources, Department of Early Childhood Education, Department of Public Health, and Medicaid, and Department of Mental Health. And so I will turn it over to Dr. Nash. Dr. Nash, it is a privilege to have you join us today, and we look forward to your facilitation.
Good morning, Stephen. Can you hear me well? Okay, thank you very much. Good morning, ladies and gentlemen, and welcome to the 2020 Voices for Alabama's Children Child Advocacy Event State Agencies Update. Thanks to all of you who joined us today to continue our focus on our children and their well-being. These continue to be trying times for our children and for their families and the communities in which they live. We are truly sailing in uncharted waters. It is incumbent upon us and all of us in various types of leadership positions as legislators, parents, educators, faith leaders, social workers, business people, and more, all of us, to do all that we can for all the children that we can, all the times that we can, in the best ways that we can, for as long as we can. We're fortunate today to have 7 of our state's leaders to share from their professional perspectives and their agencies' perspectives, what their agencies, and what we can do to help ensure successful current times for our children and their future times as well. Our time is now for our children. Our state agency panelists have agreed to provide updates on their agency's work and plans to help address the needs of our children. their families, their communities, and by extension, our state, their state. We might expect to hear from our panelists about positive, successful outcomes, challenges, budgets, COVID-19, and what messages we as children advocates should share with lawmakers and other community influencers back home in the places where we live and in Montgomery. Let me welcome and introduce our panelists. I'll introduce all of them, and then they will give individual presentations with questions and answers as may be indicated. And then I'll introduce the ones as they come on board. Our first panelist is Dr. Daniel Boyd. He represents the Alabama Department of Education as Deputy State Superintendent for Instructional Services. Representing the Alabama Department of Human Resources is Ms. Nancy Buckner, our Commissioner. Representing the Alabama Department of Early Childhood Education are Dr. Trellis Smith, Acting Secretary, and Dr. Tracye Strichik, Senior Director. Representing the Alabama Department of Public Health is Dr. Scott Harris, our State Health Officer. Representing the Alabama Medicaid is Ms. Kathy Hall, Deputy Commissioner for Program Administration. And last but not least, representing the Alabama Department of Mental Health is Ms. Lynn Bashir, the Commissioner there. We will follow the order of presenters as indicated on the agenda. Each of our panelists will give up to about 15 minutes of presentation, and then we'll have perhaps as much as 5 minutes of questions and discussion. I will work to keep up with the time on presentations and on questions, and our Voices staff member, Olivia, will identify any questions that might have been put into the chat from our participants. I now invite Dr. Daniel Boyd to give the update from the Alabama Department of Education. Dr. Boyd, welcome.
Good morning. How are you?
I am well. How are you today?
Doing well, doing well. Before I get started with the presentation, I would like to thank Voices for organizing this webinar. It is through the sharing of good information that we're able to make the best decisions for the citizens of Alabama, and also ensure that we provide the best possible education for our students so that they can be productive members of our society. That being said, I'd like to share things here at the department, starting with the coronavirus and how it has impacted education across our state. I'll also like to share some information on the task force that we have created, the SEAL task force, the continuity plans we've created with the local school districts, and the reopening of schools. So let's just start with the history. I think it's important for us to understand, in order for us to make good decisions down the road, it's important for us to know where we've been. And that being said, you guys may recall that on March the 13th of this year, Governor Ivey issued a proclamation declaring a state of emergency. At that particular point, on the 13th, that Friday, we told the LEAs if they wish they could close schools on that day, or they could close it as late as the 18th, that Wednesday. The reason why we had a window in place is the fact that there was a concern that many parents would not be able to find care for their children because they had to work on that following Monday. So we had that particular window open for that. So on the 19th, we created the SEAL task force. SEAL is an acronym for Superintendents Extending Access to Learning. This particular task force had 45 members on the team. And even though it has the word superintendent, we had a variety of individuals on this group. It consisted of principals, teachers, directors of technology, directors of instruction. So we had a lot of these particular groups because we realized it was important to get perspective from a broad range of individuals. This particular group was charged with several different things, but mainly it was charged to do the work that required collaboration with state and national organizations to reach and identify available options for the time that our students would not be in school. We also made sure that this particular group would come up with plans and efforts to identify short-term and long-term priorities for school-wide operations, both from a functional perspective and an instructional perspective. Also, the group was charged with identifying research-based learning pathways available to meet the needs of all districts in Alabama, because Alabama is very diverse in terms of its socioeconomic status and whether or not the districts are urban or rural. Also evaluate the current statewide non-traditional instruction delivery methods, which is also important for this particular group. So this group worked together, and this group is still enacted, and we're working on plans now for this upcoming school year. And part of that particular goal for the group was to ensure that we'll be ready to reopen school doors in August. So the group, again, gave lots of good feedback, which we shared with superintendents. We often sent emails out to the superintendents across the states, and also we placed information on our website detailing the results and suggestions made by this particular committee. So schools formally closed on the 18th. We reopened schools 3 weeks later. And when we reopened schools, the schools look totally different from what they looked prior to that particular point. Noting mainly that the fact there was no face-to-face instructions. And this was a huge learning lesson for all of us, particularly, as I mentioned before, the diversity of our school districts. So in order to make sure that we had good instruction during this particular period, particularly since there was no face-to-face instruction, we as a State Department team developed continuity plans. Each local educational agency came up with the plans, and the plans focused on several different areas. It focused on delivery options, instruction, and assessment options, and it also focused on final course grade options. And that way we were assured, and the districts were assured, all stakeholders across the state were assured that even though we weren't meeting together as we did in the past, good quality instruction was still taking place. So let's talk about the lessons learned. As again, there's lots of different types of school districts. When you look at it in terms of the makeup, you have urban, rural, and suburban schools, and they vary considerably. In terms of local funding, you have high, medium, and low socioeconomic status, which also impact the schools on how they rolled out their particular continuity plan. So you had some districts that had one-to-one initiative, which facilitated learning, and others used packets in which they handed those out to the students. Some of the districts had learning management systems using Blackboard, Moodle, Haiku, or Schoology. And some districts were real innovative in how they were able to provide internet connectivity to the students. Good case in point was Perry County. Superintendent John Hurd purchased hotspots for buses, and he placed the buses in certain locations throughout his county, and the students would come in, park there, and they were able to download information. Again, lots of good information was gleaned from the districts throughout our state on how they were providing instruction to the students. So we used all this information to prepare for what we'll be doing, which is, of course, to reopen school this upcoming fall. Of course, the SEALS Task Force has worked with us tremendously and done an exceptional job providing some really good information. Federal government has stepped in through the CARES Act. The CARES Act, or CARES is an acronym for Coronavirus Aid, Relief, and Economic Security Act. A considerable amount of money was set aside at the federal level. $13.2 billion went to elementary and secondary school education fund, and Alabama received $216 million to go towards that particular initiative. With this particular plan, we sent out applications to all school districts. We have approximately 25 that have submitted their application, but in the application, they will share with us how they will use those particular funds. The money will be used, it has two top priorities. One priority is the funds will be used to improve remote learning, and the second priority is to decrease the learning gap within subgroups. In the event those are not top priorities for LEAs, they can use the money to improve teaching and learning across the state, particularly as it relates to the problems created by COVID-19. So using all of this together, we're working on the roadmap. We will have a meeting next week with all the superintendents across the state. We have the SSA, or the School Superintendents of Alabama Conference, which will be held Monday, Tuesday, and Wednesday. And on those 3 days, we will discuss roadmap options and how we will reopen schools across our particular state. It is really important for whenever we develop these plans that we collect good quality information. There's a saying that a plan can only be as good as the ability of us to collect good information. So we have worked with the school districts to provide survey instruments to stakeholders so they could capture that information, so they could be helped on how to create a plan that will continue to help them to improve teaching and learning. So the survey instruments is categorized by different categories, dealing with students, dealing with staff, dealing with buildings, dealing with technology, and other different areas there. So for example, in the case with students, the questions would be asked with what percentage of students will be returning, what percentage of the students have pre-existing conditions. In terms of staffs, the survey would include questions, similar questions, how many of the staff members will be returning. We're not really sure now how it will impact retirement. We have many of our teachers across the state that have way more than 25 years, so we anticipate that we may have a higher number of them retiring, which means that we'll have to deal with that shortage. We historically already have a shortage in the area of math, science, and special education, particularly at the secondary level. But that information will be really important for us to come up with plans. So in terms of the building, it's going to be really important for our principals to consider that there should be a holding room in the event a student is sick and has a temperature above 100 degrees. So we can keep that particular student in that room, so we can call the parent to come pick up that particular student. Things have truly changed, and there's a saying that there's a new normal, is without a doubt. We're dealing with issues we've never dealt before, but I must say that the agencies that we've worked with, the Alabama Department of Public Health, DHR, and all the different agencies have worked with us and have been tremendous partners through this pandemic, and we truly appreciate their support. We appreciate the assistance from our legislators. Senator Poole, Representative Poole were outstanding working with us on the budget and so forth. So tremendous amount of work, including people from the governor's office. A lot of individuals are helping us, guide us through this particular process to make sure that we make the best decisions for our students and everyone across our state. So going back to the plan, we're also, as I stated before, looking at technology and so forth. We also want to make sure from an instructional point of view that we have tools, learning management systems that will enable our schools to be able to manage the learning of students, which was a problem when we closed schools down in the spring. So we have that in place already. In the event a school district does not have Blackboard, Moodle, Haku, or Schoology in place, the State Department will provide to districts across our state Schoology at no cost. And we'll also provide the training and so forth. And that's also, as I mentioned before, CARES Act money to use to enable school districts to purchase laptops and to also increase Wi-Fi connectivity across their respective districts. The plan, the reopening roadmap, the plan will consist of a lot of information. But some of the areas that it will cover some points associated with teaching and learning. We want to make sure that teaching and learning does not stop. We want to make sure that all of our students and parents take advantage of this new method of teaching and learning. We want to make sure that our assessment systems are in place and that it will be flexible. And we want to make sure that we design good, solid remote learning opportunities for our students. When the school year opens up, we feel there will probably be 3 different options associated with that. One option is, well, you'll have schools and parents who will go through the traditional route, which means that learning will take place in a traditional learning environment, in the classroom as it was this past school year, where you'll have face-to-face instruction and you have the daily physical attendance. In some cases, we realize that parents have already voiced concerns that they do not want their children to go to school. So for those particular individuals, we will have a virtual learning option. Some time back, we went ahead and did a RFP, a request for proposal for vendors to provide bid information on services that will be provided to us so that we can share this with the local educational agencies. And this would be the virtual platform for us to provide instruction to the students. So again, As I stated before, it's important to understand where we've been to know where we're going. So based on what we've learned this past spring, we're going to use that information to make sure that we have a virtual platform for all school districts. So those school districts that are in a lower socioeconomic status can take advantage of a state-sponsored virtual program. And again, coupling that plan with funds from the CARES Act, they could provide Wi-Fi connectivity to students in some of the remote areas of our particular state. Another option, so as I mentioned before, we have the traditional option, we have the virtual option there, but also there's a possibility that we'll be using a blended option. So in the event you have a situation where we've opened up our schools in a traditional option and coronavirus hits a particular community or a particular school system, then at that particular point, that school system could go in a blended pathway, which means that you may have some students in the schools doing the traditional pathway and others doing the blended, where it's the instruction now takes a virtual format. So with the blended, you have a combination or a hybrid of the traditional and the virtual pathway. We feel that by making sure that we're prepared for these three options, that we'll be well prepared and our districts will be well prepared to handle the issues associated with the coronavirus. If you listen to the news, it's stated that by experts that it's not a matter of when, but it's not a matter of if, but when we'll have another outbreak this upcoming fall. If that is the case, with this plan that we were putting in place, we'll be prepared to deal with that particular situation there. Again, the plan is going to be revealed at the upcoming School Superintendents Association meeting, which will be Monday, Tuesday, and Wednesday. I really appreciate the good work that the SEAL Task Force has done to help guide us through this particular process, and I also appreciate the feedback from educators across the state. And again, it's through working together that we're able to come up with the best possible plans to make sure that we provide our students a good, strong education.
It will be done for the fall. I think Olivia may have a question or two in the chat. Olivia, do you have? While she's gathering that, Dr. Boyd, one of the things you mentioned the three options, the regular, if you will, the regular in place education for our children. Then you mentioned the blended or hybrid, and then fully online would be a third option. I know one school district that I've been familiar with has said that it will give those options to the parents of the children. Is that what you are anticipating as well, or will it be other factors that will determine how the children will be taught?
I do feel that many school districts will go that particular route and allow parents to choose whichever option they feel would be best for them. Our responsibility as the State Department is to make sure that whatever option the parents choose and the districts go with, that we have this for them and support them in every possible way.
Okay, thank you. Olivia, do we have any other questions that you'd want to highlight? Go ahead.
Yes, we have two that I think were answered. The first one is, what was the amount of increased funds for the English Learner Initiative?
It was a significant increase. I don't know the exact amount. I don't know the exact amount, but I can email that information back to you.
Okay. And then the second one that I don't think had been answered yet was, is there an online teaching option for teachers who have an underlying condition or are not comfortable coming back in the classroom?
Yes, that decision actually would be a local decision made by the local superintendent. But in the event that the school district decides to go that particular path, we'll have Schoology as the learning management software system that will be used. And also we will have virtual classes, the content for virtual classes that can be used. But again, that's going to be a decision that will be made by the local educational agency.
I think that's the only ones that you didn't already answer. So thank you so much for everybody's questions.
Appreciate you and the department and all of our local school districts, and we'll look forward to how this impacts our children, their families, our communities, and our state as we go forward. Thank you so much.
Thank you, Dr. Nash.
Now I'd like to introduce Commissioner Buckner, Commissioner Nancy Buckner of the Department of Human Resources. Can we bring her on?
Good morning. And first of all, I want to thank Voices so much for doing this. And I'm going to probably go through pretty quickly because I know we're a little short on time. But Dr. Nash, it is always good to see you too. At DHR, we have been extremely busy. All of our staff are essential workers, so they have worked constantly and things have really picked up. In the child welfare area, due to COVID-19, it has been quite challenging. Our child welfare staff are teleworking some, coming into the office some, but all of the field work is still going on. We're fortunate lately because we have been able to find more PPEs for them to use when they're out in the field. One of the things I want to share to the advocates this morning is that we are concerned about children across Alabama, because when you look at our statistics right now, the number of child abuse and neglect reports is down about 22%. That is a concern across the nation too. Preventions, which you know is not a can report, but it is concerns that just don't rise to the level of a can, and those are down about 32%. We believe this is due primarily to the children not being in school, and for the teachers who see them and know those children very, very well every day are not able to see them, and therefore they're not reporting this. For an example, normally mandatory reporters in education account for about 22% of our child abuse and neglect reports. In April of this year, they accounted for 6.7%. When you look at the preventions, people in education account for about 31% of them. At least that's the numbers from January, and that number pretty much holds throughout the year. In April, they accounted for 2.2% of those. So there is great concern on our part about the children. We have continued visiting our children. Right now, we probably have around 30 children who have tested positive for COVID. Most of those have been in some facilities. We have had some in foster homes, but we are just very grateful to our foster parents and our other providers out there that take care of our children and take them in. And I'm very thankful for Dr. Harris, because we've had some facilities that wouldn't take them until we got them tested to prove they were not positive for COVID, and he's helped me work that out. So thank you for that, Dr. Harris. We have been having court virtually. We're very thankful to the judges that did that. However, our court time has been reduced, and we can tell that in our permanency. Our exits from foster care have decreased about 28%. That concerns me too, but I do think everything is picking back up, and so our staff is working hard to bring about more permanency for children. Our judges are working with us, and AOC is too. So we've got a little bit of catching up to do. We've been able, like I say, to have shelter care hearings and some of those type hearings to keep children safe when people do report it. But we need to get permanency for some children now, so we're working on that. Currently, we have about 6,300 children in foster care. During the times we knew children were home, they were costing foster parents more, so we feel good that we were able to do a little bump in the board payments from March the 16th to May the 31st. Also, foster children are in receipt of the pandemic EBT benefits. Just want to mention to you too, in fiscal year 20, when you look at the reasons children are coming into our care due to safety issues and lack of parenting skills to take care of their needs, and you peel the layers back, you see that in 42% of those children, there was an underlying cause being substance abuse, drug use. The methamphetamine is still the main drug that we are seeing at DHR. It made up for about 35% of the children that were entering care that had parents involved with drugs. I want to move on to the SNAP program because it has been booming lately. As you know, applications increased. Just going from February to March, we had a 155% increase in our internet applications. I'm very thankful that our federal partners, Food and Nutrition Services, has allowed states several waivers, and we have applied for several of them ourselves in Alabama and have been approved. One was to raise the maximum benefit level up for all the households. We have been approved for March, April, May, and June. We have a pending waiver up there for July. The March, April, and May benefits have gone out. That accounted for about $124.4 million in the state. June will be going out and be available July 1st, and that will account for an additional probably 42 more million. One of the big waivers we applied for was something called PEBT, which is Pandemic EBT. This allowed us to give SNAP benefits for those children in school systems where they were participating in free and reduced lunches. I'm very thankful to Dr. Mackey and his staff for supplying their data with us and giving us quick responses to our data. We were the 7th state to be approved for this, but we were about the 2nd state in the nation to get our program up and running. It's being done in phases, so we are not finished yet. We hope to be finished by the end of this month, and then we will be doing some cleanup work in July. What it did, it gave like $5.70, which is the cost of the free and reduced meals per school day for about mid-March through the end of May, which are the days that children would be participating in those lunches at school. It's for pre-K through 12th grade. As of today, we have served approximately 400,000 children, and that has amounted to about $115 million in benefits. And I'll have to tell you, I generally see a lot of complaints at DHR, but we have gotten a lot of compliments from parents that are just so grateful for having received those benefits. And it's been really, really quite refreshing for us around here to see all of that. I also want to mention that we have given $1.5 million to the food banks because they were a little short on funding to help feed people across Alabama, and we were just really, really happy to be able to do that for them. Also, in regard to the budget, I think the legislators did a remarkable job this year of the budget in light of everything that we have, and they are certainly to be applauded for their work. I was also very pleased to see that there was a slight income in child advocacy centers, which are a great help to us in our child abuse and neglect investigations. The Boys and Girls Clubs partner with us on several things. And I'm very, very happy to see that for the first time in history, the network of family resource centers was included in the budget in the state of Alabama, which I think is long overdue. And we partner with them a lot, and they do a lot of phenomenal work for us. So I also want to say that we're working on several things. One being with Department of Child Abuse Prevention, possibly some more fatherhood initiatives. We have quite a few and a long-standing history partnering with them on fatherhood issues anyway. So we're looking at partnering a little more with rehabilitation services, and I do have a few concerns because I think that that department has a little shortage of funding, and I hope we can find some ways to help them because they serve a lot of children. A lot of our children overlap. DHR serves about 1.5 million people per year, and it will be a lot more than that this year because of some of the programs that we have done because of COVID. But we need these other entities out there like rehabilitation services, Department of Child Abuse Prevention, family resource centers, child advocacy centers, and the list goes on. And I don't mean to leave anybody out because DHR, we need the help from everybody to serve all of the children and families that we serve. I know there's a lot of interest in the Voices group about child care, so I want to mention it today too. Currently, we have 1,268 licensed centers. 508 exempt centers, and 657 family daycare homes around the state. Of course, they're not all open right now. As far as the number of subsidy children on roll, there's 46,145. As you know, COVID-19 has caused most of the child care centers to be closed initially in March, but we have been doing surveys and working with a lot of providers over the past few months. We have been assisting with, for the subsidy centers, with sustainability payments, and through May, we had given almost $38 million in sustainability payments to try to hold the centers up, to keep them going, so when things got better, they would be willing to open up and take children in, because we know for the economy to be good in Alabama, people have got to work, and people can't work if they're worrying about where their children are and not having adequate child care. So I think in workforce, that is one of the should be, and hopefully is, one of the highest priorities. It certainly is in the groups that I'm working with. So at this point, in addition to sustainability, the 38 million, we also have about 7 million more obligated for that. We've also been providing child care for some of our healthcare workers and first responders across the state too. As I mentioned the surveys, and I want to share with you this morning, and I think it's some pretty good news, not where we want to be, but we are improving. March the 24th was the first survey that we did. And at that point, 12% of the child care entities, and that's licensed centers, exempt facilities, and licensed family daycare homes, was open. April the 15th, we did another survey, 15% were open. On May the 6th, 27% were open. On June the 9th, 40% were open. And I'm happy to tell you today, as of yesterday, I believe June 17th, 53% are open. So we are moving in the right direction. Are we where we want to be? Absolutely not. And we've got to keep finding things to incentivize these centers and help them to open. Right now, on licensed centers, 51% of them are open. On exempt facilities, 45% are open. And on family daycare homes, 63% are open. So we have some exciting work going on at DHR, and we are looking for ways to help other people open, and to help some that are open continue to be open. I want to tell you one of the things, because we're having a conversation with these centers when we do these surveys. Their concerns are just general fear of the coronavirus. And I know that we all have that, but they certainly share those. And when you're taking care of somebody else's children, I think your fear even heightens some with that. Another one concern is how to maintain the 6-foot distance that is recommended. Also of concern in regard to that, they're having to lower the numbers of children in the centers to do that. There is also a lack of supplies, and there's just plain economic hardships. So like I say, we are excited to be looking at ways to help providers. We have some more things coming, we believe, and we're working on that, and hopefully over the next few weeks we will get some of those things finalized. And in the meantime, we are trying to make sure that providers can get what they need, and that's all important to make sure our children are kept in safe environments. So that's all my comments this morning. So if you have any questions, I'd be happy to try to answer them.
Out any questions that are posed in the chat. Let me just tell you how important it is, I think, for the collaboration that DHR and other state departments looking after our families and children, how important collaboration is. And so thank you for the ways that DHR is sharing resources that it might have that other parts of our state government may not have. So thank you very much for that. Let's go now to Olivia, see if there are any questions. But let me, before you do that, Olivia, just to remind everybody that there can be questions posed in the chat. The chat section will be saved, and answers to questions will be posed and made available to our participants later. And if you have a question, please don't hesitate to ask that. Olivia?
Thank you. So our first one, we have about three if we've got time. So how many foster parents are licensed right now in Alabama? And then has there been any impact in recruitment and training and approval of new foster care homes since COVID started?
I don't have the exact number. I would say probably 1,700 are licensed right now. Recruitment has greatly slowed down since COVID started because people were scared to meet. We do have some that we had started and we're finishing up, and we're about to open up our training and all of that and recruitment because we always need foster homes. Oftentimes people foster for a while, they may adopt a child, that may have been what they wanted, and that's perfectly fine. It's just we need good people to take our children because, you know, every child needs a home to go to. We all do. We need family, whatever that family looks like. One thing we have also been pushing in child welfare is something called kinship guardianship. And we have quite a few more kinship guardianship homes than we have had. And so that's important for children too, because that's their family too. But we work a lot with the State Foster Parents Association in recruitment, and we've got a couple of big projects that we're going to be coming out with over the next several months in regard to recruitment.
I think we're going to have time for just one more. So is there similar meals funding available for families with children 0 to 3 who would be attending childcare, but they're not right now?
I do not know of one. When Congress passed the act that they passed that allowed us to do the pandemic EBT, it was specific in that act what children that was for, and you had to have already been participating in a particular, and it's named after a man, and I'm sorry I can't call his name right now, but they have to be participating in that. So that's why pre-K through 12th grade was some of the, I don't know of any child care centers that were participating in that, don't even know that it was available for them, but it is very specific in that act that that's the children we could serve with the PEBT.
Yes, ma'am. Well, thank you so much. I think that's all that we're going to have time for, but anything else we will send out.
Thank you very much.
Thank you.
Okay, thank you, Commissioner Buckner. We really appreciate you and all of the department and all of the folk that work on behalf of our children there. Now, let's turn our attention to the Alabama Department of Early Childhood Education. We have Dr. Smith and Dr. Strichik. And Dr. Strichik, I hope I'm not messing up your name. I hope that what
Strichik.
Okay, thank you very much. I wondered how badly I would be doing that, so forgive me, please. Okay, so we have two representatives from the Alabama Department of Early Childhood Education. So are you all going to share the 15 minutes that you have, I hope?
Yes, we are.
Okay, all right, so
Dr. Smith,
take it off.
First as well.
Okay, please, Dr. Smith.
Hello, everyone. Can you hear me? Yes.
Yes.
Okay, well, I would like to first thank everyone. Thank you, Voices, for this opportunity to present updates from the Department of Early Childhood Education. One of the very big updates that we have is that our illustrious, awesome leader, past leader Gina Ross, has retired. But Dr. Tracye Strichik and I are here today to represent the department. And we would like to start off by saying that the department administers the nationally recognized Alabama First Class Pre-K program. We serve as the designated state lead agency for first teacher home visiting. We also have pre-K through 3rd grade, the early learning initiatives in the department, Head Start collaboration, children's policy councils, infant and early childhood mental health, and child care quality coaching. In December of 2019, Alabama was awarded a competitive $33 million renewal grant over the next 3 years to continue building upon the work of the preschool development grant, Birth to 5. With this grant, we are working to improve and facilitate program alignment and cross-agency communication to ensure a seamless transition for children and their families from birth through school entry. And we are proud of the partnerships that we have with other state agencies. In partnership with mental health, we are supporting 14 new infant and early childhood mental health consultants to address the critical needs of early childhood education providers, and certifying 35 mental health clinicians to bridge the gap in service delivery for birth to 5 years to increase equitable access to mental health services in rural areas. In partnership with K-12 through the Department of Education, we are helping to build a continuum from pre-K through 3rd grade in shared professional development. In our partnership with Human Resources, we're helping to support quality in childcare. And in partnership with Public Health, we're ensuring infant mortality reduction as a priority. And I'm also proud to indicate that we also in the department partner with the Head Start community as well as with other ECE delivery systems to serve Alabama's most vulnerable children. In the 2019-20 school year, first class pre-K has a diverse delivery system, but in this year, 94 of the pre-K Head Start classrooms, were Head Start as well. And we contributed $4,129,655 to support Head Start programs in 2019-20. It is projected that in 2020-21, there will be 83 of the first class pre-K programs in Head Start centers, and that $3,844,471 will go toward Head Start classrooms. So I'm going to now turn it over to Tracye, and she will tell you where we are with the budget.
I think Dr. Smith alluded to this, but for the 14th consecutive year, Alabama has been ranked one of the highest quality pre-Ks in the nation by the National Institute of Early Education Research. And as we continue to show yearly from results from our outside research and evaluation team, that those that attend first class pre-K are more likely to be ready for kindergarten, proficient in reading and math at that 3rd grade level. They're less likely to be retained in a grade and chronically absent, and they're also less likely to need special education or have discipline issues. So we're very thankful to Governor Kay Ivey and legislature for continuing to support efforts in our department. Last year, May 2020, the Department of Early Childhood Education received a $6.95 million increase, and $6 million of that went to Alabama's first class pre-K. $450,000 went for the Governor's Strong Start, Strong Finish initiative, and $500,000 for the Alabama Family Central Clearinghouse website. We still are seeing needs in our Alabama First Teacher home visiting program, particularly with COVID. We're seeing large wait lists of families that are needing assistance from those home visitors. Their department received 163 new classroom applications, and 123 of those met the qualifying criteria for funding. I believe we funded 55 to 56, I think today is 56 new classrooms with 68 on the wait list. And so as we look at individual data, we have a centralized intake system where families register for pre-K. We're seeing large wait lists for the upcoming year. Alabama Family Central is a new line item, and it is a mobile-friendly clearinghouse website. And this is done in partnership with the Department of Early Childhood, Department of Education, DHR, Public Health, Medicaid, Mental Health, Rehab Services, Child Abuse and Neglect, and the Office of Information Technology. The scheduled launch is June 15th, 2020. So you can be on the lookout for that. That was launched Monday, and all agencies have been involved for almost a year at building this website for families. During our experience with COVID, we've really worked closely with the Department of Education and DHR and ensured that our plan was aligned with theirs. All of our programs have moved to a virtual setting. with all coaches, monitors, and home visitors continuing to provide support to educators and families. The Department of Early Childhood Education Academic Continuity Plan is on our website, and it was coordinated in alignment with ALSDE. Our home instruction for early learning supports families as their child's best and first teacher. Our coaches actually drove to schools and provided backpacks to the teachers, and in turn, those teachers provided those backpacks to families and children with activities that encouraged home learning. We are continuing to work closely with ALSDE. Those from our department sit on the SEALS task force. We're ensuring that we're aligning all of our efforts with them as we continue to look at how we will open school. And also we have a movement to continue to ensure that Alabama's B5 children are the best prepared in the nation. So for more information, you can visit bornready.org. And we know that when schools reopen in the fall, regardless of that learning platform, children are going to be entering behind with the gap. And so we are partnering with ALSDE and DHR to provide what we call AlaKids. And it's the Alabama Kindergarten Inventory of Developing Skills. And so it'll be a kindergarten entry assessment that will provide data to our kindergarten teachers on where to meet that child. And it's a whole child assessment that is literacy, math, social emotional, and physical development. So we're very excited about that rolling out in the fall. Thank you.
Go to questions. Go to questions. I'm not hearing you all at this point.
Yes.
Okay.
Yes,
okay.
please.
Yeah. Thank you very much.
Yes. Move to questions.
Okay. While Olivia seeks to see if there are any questions, I just wanted to comment on the 68 applications for first class pre-K. What's the availability of funds to support that? When do you think those applications will be able to be funded?
We received an increase of $6 million for pre-K, and we were able to fund 56 new classrooms. So there are some on the wait list if any funding becomes available for those 68, those others that are the 68 that would receive funding.
So may I assume that the request for the funding for those 68 is in place, working its way through somewhere in the legislature or governor's office? Okay, good. I see your head going up and down. Yes.
So are you asking when our? Yes.
Okay, thank you. Thank you very much. Okay, let's go to Olivia. Any questions for these ladies?
So I think that there's only two that we weren't able to answer. So what is the process to apply for free childcare for first responders and healthcare workers?
I believe that would be a childcare Commissioner Buckner question, okay. But we can work with them to get that answer because I'm not sure.
We can go back. I just it came up during y'all's time, so I was like, well, let's go.
Okay.
And then now this might not be for y'all either, but what gaps remain to be able to support all eligible Alabama families with first teacher?
Well, we didn't receive an increase this year,
okay.
But hope to in the future because we are showing large wait list. This year, we were able to move to serving families in all counties. And we were able to use some of our state funds to pull down Medicaid match. So we're hopeful, and we're seeing some of those pediatricians are referring families to first teacher home visiting only to be put on wait list. And so we're hopeful that we will receive an increase in funding. And we're also partnered with DHR as well on providing, usually if we can approach them with, look at some of our wait list, this isn't aligned with their priorities, and they've been able to help us with funding some of those counties that are having some large wait lists. So we've gotten very creative in blending some of our funds with first teacher home visiting.
And we did just get one more come through. Will there be an option on the alabamafamilycentral.org website to search for parent education programs?
There will, yes.
Okay.
It's a very family-centered website.
Okay. Wonderful. That's all I have on my end. Thank y'all so much.
Thank you.
Harris is the state health officer with the Department of Public Health. If you could bring Dr. Harris on. Dr. Harris, this is Charles Nash. Can you hear me there?
Hey, good morning.
Okay. Yes.
Yes,
Good morning.
I can hear you just fine. Can you hear me all right, Dr. Nash?
I can hear you fine.
Great.
Thank
Good
you
morning.
so much.
It's good to see you. And
it's good to see you too, and I look forward to your presentation.
Thank you.
I think we have a little delay working.
Thank you. It's really a pleasure to be here with you today. Yeah, it sounds like yeah, we're on the international satellite there. There's just a couple of second delay, but yeah, thank you so much for having me. I really appreciate this opportunity. This is truly one of my favorite things I've gotten to do since I've been in this job, is join your group every year. We certainly appreciate so much what you do, and I just can't tell you how much I appreciate it. And it's also nice to be with a group of people who I know really care about all the same things it seems like that we care about, and that's always a nice thing to be a part of. So thank you so much for having me. I wanted to really just start off and talk for a few minutes and sort of just update on the COVID situation, because I think that is so important to so many other things that are going on. And after we do that, I'll try to give you a little more of the sort of traditional topics that we normally cover for a session like this. But just to remind you of where Alabama is, we continue to have a very significant problem in our state with disease transmission. We are seeing case numbers that are going up, much like around 22 or 23 other states are doing. There are many, almost half the country now that has case numbers that are ascending, and it is quite worrisome to us. You know, the United States, as you know, has about 4% of the world's population. We have about 25% of the deaths in the world by this disease, and no state has been unaffected so far. And yet, you know, there's an interesting public perception out there, because this disease does tend to be not everywhere at once. The water is not rising equally fast in all parts of our state, and so our urban areas have been dealing with this for quite some time. We're beginning to see this more in rural areas, but there are some parts of the state that still seem, relatively speaking, unaffected, even though all counties have seen cases. COVID-19 is a disease that disproportionately affects our African American citizens in our state. This is a health disparity that's not unique to COVID-19. It's a health disparity that we see in many other conditions, unfortunately. But we know that Black Alabamians disproportionately have chronic health problems. They bear a disproportionate burden of things like cardiovascular disease and chronic kidney disease. And we know that they are more susceptible to serious illness and even death. So we've unfortunately lost about 800 Alabamians to this disease so far in the past 3 months. Well over 40% of those, around 45% of those deaths have occurred in Black Alabamians, even though African Americans represent just over a quarter of our state's population. So again, COVID-19 hasn't created a health disparity. It's revealed a health disparity that's already been there, and it's tied to those same social determinants that we see in these communities where people don't always have access to care, where they have other underlying health problems. Right now, we have reached around 28,000 confirmed cases so far in the state of Alabama. What's more concerning to us is that that number has increased by almost a third in the past 2 weeks. We are testing a little bit more, but over the past 2 or 3 weeks, we've increased our testing around 8 or 9%, and yet we're picking up about 30% of all of our cases during that time. So clearly the increased numbers we are seeing is not a reflection of increasing numbers of tests. It's a reflection of the fact that we have ongoing community transmission occurring in many parts of the state. There are some situations where we know why a hotspot has occurred when we have an outbreak in a workplace or in a skilled nursing facility, for example, but we certainly have places where we can't link that to a specific location or event. And so, for example, that's what we're seeing here in Montgomery County. We've increased our numbers tremendously, even though there are counties with larger populations like Jefferson and Mobile. Montgomery County now leads the state in the number of confirmed cases. That is showing in our hospitals here in this area. And in fact, even statewide, hospitals now have less capacity than they have ever had during this entire this entire response. We have now, as of today, about 250 ICU beds remaining in the entire state out of about 1,400. Most hospitals are dealing with that, and in fact, they're dealing with that in Montgomery as well. But the system is really strained, and we're certainly concerned about what the next couple of weeks are going to look like. As of today, we have close to 1,100 inpatients in the state who are either confirmed or suspected to have COVID-19, and that's by far the most that we've seen anytime in the past 3 weeks. So that raises a lot of questions about where do we go next. One of the most important questions we get a lot has to do with reopening schools. I know that's on the minds of many of you. Dr. Mackey and his team have done a tremendous job. They've been working for months now on a plan to safely reopen if circumstances permit to do that. I think ultimately a lot of those decisions are going to be made by local superintendents and local school boards, but we have been working very closely with them to make sure that if and when reopening occurs, it can be done as safely as possible. There are a lot of good common sense rules that need to be put in place so that people can be safe. And you know, we hear a lot, well, there's no problem with reopening schools because kids don't really get sick from this disease, right? And in fact, that's somewhat true. Children are much less likely to have serious disease. We have unfortunately had around 50 or so cases so far in children under age 4. We've had a handful of deaths in pediatric populations, although most of those were in children that had certain chronic health problems and were not just normal healthy kids. Nevertheless, we still don't want our children to get sick. We want our children to stay healthy and be free of disease. And certainly we understand that children have parents and they have grandparents and they go to church with people that may have chronic health problems or who are older and encounter other people in society. So we really, really want to be sure that we have a good plan in place that protects our kids. And that's certainly one of our strategies for protecting everyone in our community. As we have, as everyone's probably aware, this is especially a disease that can be catastrophic for our seniors. When we have nursing home associated outbreaks, the outcomes are just terrible. And around half of the deaths we've seen in our state have been in people who reside in nursing homes, nursing facilities. And so even though those facilities have been closed to visitors now for over 3 months, we still continue to see outbreaks that are occurring there. And that's a really, really vulnerable population that we are trying very hard to protect. There was certainly a great deal of federal funding made available to states for dealing with COVID-19 response. We really appreciate what our congressional delegation did to make that available to us. You may be aware, but the state of Alabama received around $1.8 billion for COVID response, which is tremendously encouraging. I would point out to you that from the standpoint of a state agency, that funding is not just, it's not really money that's available for us to obtain and go through our normal processes of developing programs. It's really essentially a credit line for us, so that when we actually have actual expenditures, then we can essentially invoice state finance to access that money to reimburse us And that's terrific. We really appreciate that. That's gone a long way towards paying our personnel costs for the things we've been involved in the response. At the same time, that money is expected to go away at the end of December. And so as of December 31st, whatever money is not spent, we presume we will no longer have access to. And so it's been challenging as we ramp up our contact tracing programs and our testing programs. We really have to find the resources to get those things done and pay for them, and then we can turn around and get reimbursement from the CARES Act. But otherwise, that money is not readily available to us. I'll just probably finish there in terms of talking about COVID specifically, but just wanted to mention a few other items to you, and then I'll certainly be glad to take questions on whatever you like. One thing I would like for this group to be aware of is the precipitous decline in childhood immunizations that is occurring in our country right now. This is directly as a result of COVID-19. Schools have been closed. There haven't necessarily been parents who were forced to go get their kids immunized to get them into school. Many people are staying away from seeking health care, and that's true not just for pediatric populations, but even for adults as well. Many fewer people are trying to obtain those services that we would normally think of as sort of maintenance health care or elective health care. And so on average, immunization rates in our country have fallen over 30%. It's a tremendous decline. It's a tremendous issue that we are concerned about. We are working hard with a number of folks, including the Alabama chapter of the American Academy of Pediatrics, to get messaging out to remind people the importance of getting kids vaccinated, even when they're not returning to school right away. Obviously, we need them to be immune to these normal childhood diseases that we often don't have to think about because most kids are vaccinated in our state. But we've seen significant drops in those numbers, and that's a very important issue to us that we're working to address. We had sought legislation this year before the legislative session was forced to end early related to our state's immunization registry, which is called Imprint. We had sought to make sure that all providers who give immunizations to children enter their information into Imprint. Most of them do, in fact, but not all of them do. And we think it's very important to have a complete registry so that we know how effectively kids are being immunized in our state and understand where our weaknesses are and how to address that. That legislation, unfortunately, had some support, but had a tremendous amount of opposition from the same folks who oppose anything that has to do with vaccines. And so we fought a lot of misinformation. Unfortunately, we had a lot of very difficult discussions and a lot of explanation that we tried to do to explain the importance of protecting our kids and keeping them safe. But there certainly is the word vaccine is certainly a trigger for some people, and you sort of mount a lot of opposition in spite of good intentions and in spite of well-meaning policy. So we certainly would like to continue to try to have a comprehensive vaccine database in our state. We think it makes sense. We think it's reasonable. It certainly doesn't prevent anyone from not receiving a vaccine if they choose not to. It's not coercing anyone to if they are otherwise exempt from receiving vaccines. But we'll continue to work on that. One of the biggest budget issues that we faced this year, of course, was related to the Children's Health Insurance Program, or CHIP, in Alabama, known as All Kids. As of this year, Alabama is back to its normal sort of state share, its baseline FMAP rate. So that actually required over $60 million in general fund appropriation so that Alabama could pay its share of CHIP to pull down those federal dollars for the program. We really appreciate the legislature being supportive of that. We appreciate the support of people like Voices and many of you that are here on this call. CHIP is such an amazing program. It provides health care to children who are in very vulnerable situations in many cases, and we're very proud of the program that Alabama has. CHIP, the All Kids program in Alabama, is really one of the nation's best CHIP programs. So only a couple of years ago, we paid no state match. There were no state dollars that went to that program, And then over the last 2 years, that's increased to our baseline rate, now requiring over $60 million a year. That's a tremendous commitment, but we appreciate the governor's support of that. We appreciate the legislature's support of that. We appreciate your support of that. And CHIP seems to be in very good shape, certainly for the foreseeable future. Because healthcare costs go up and because enrollment traditionally goes up, that state share will increase a little bit more, not as a percentage, but as an absolute amount. And so probably somewhere in the mid $60s million range next year, $65-66 million is going to be required on the part of Alabama to cover the state share for that coming up next year. So it is a big investment, but it's certainly a tremendous program that we're very proud to have in Alabama. So I think I'll just pause right there and certainly be happy to answer any questions if anyone has anything they'd like to talk about. And thank you again for having me.
Thank you, Dr. Harris. There are some questions in the chat that Olivia will call to our attention in just a moment. And let me start with perhaps a short answer from you, if there is a short answer to come. Tell us a little bit about antibodies and immunity.
It gets asked a lot. Yeah, as you know, there are different ways to test for this disease. And when we're looking for a patient who's actively ill, we do a viral or molecular test, which is the nose swab test to determine if there's active infection going on. But you can also do blood tests, and in some cases, even a test of saliva, oral secretions, to look for the presence of COVID antibodies. What that will tell you is if you have been exposed to COVID-19 at some point in the past. And so you see those tests being offered out there in the public. There's for the first few weeks of this response, FDA did not even require anyone to prove that their COVID antibody test worked. You simply had to attest that it did and say that you had verified it yourself. And so we had hundreds of different antibody tests all on the market, all within the first couple of weeks of this outbreak. And we know that many of them were not good tests and they didn't agree with each other. And many of them weren't even looking at actual coronavirus antibodies. So FDA has now gotten rid of most of those tests, and the tests that remain can detect COVID-19 antibodies in blood or serum. So that's useful for knowing if you've been exposed before. What we don't know at this point, however, is can you get this disease again, or do you have immunity? If you've been exposed, can you assume you're never going to get it again, or can you assume that you may get it again, but it might be a few months of protection that you have? We simply don't know that right now. And so we don't recommend the use of antibody testing to really answer any individual clinical questions about a given patient because we just don't know what the antibody results mean. Now, antibody tests are useful to us in public health on a broad basis. So to go and screen a community for antibodies gives us an idea of how widespread the disease was in that community, since we know many people can be infected but not have symptoms. So antibody tests are useful for public health, but until we know more about how antibodies protect you, or if antibodies protect you, it's not that helpful for an individual patient.
Okay. Thank you. Olivia, are there 2 or so questions that we can pull out of the chat?
Yes. So we have about 4. So let me try to pick the most exciting ones. So what has the department been able to do during the pandemic to support healthy prenatal care? Things like telehealth or home visiting, anything like that?
Sure. This has been challenging, in order to supply all kinds of healthcare during the response has been very difficult. We continue to try to work with moms in our clinics. Our county health departments continue to see people. We are doing many visits by telehealth, not necessarily billable visits, but it's ways for us to stay in contact with people and to make sure that we can give them proper advice and recommendations. Our WIC program continues, the Women's Infants Children program, as you know, which is for infants and for moms who are expecting, or for young children. WIC has actually gone to a full EBT model, just like a debit card, so that people don't have to make those visits to the county health department to pick up vouchers or to stand in line and so on. We can now address all of those questions just electronically through the computer. So when someone has benefits, we can just refill those remotely. And for the client, they can go to a grocery store and just swipe their card, just like anyone is swiping a debit card for their checking account. And so we think that's helpful as opposed to having to pull out paper vouchers, which unfortunately can be stigmatizing a little bit when you're trying to buy your groceries using vouchers. And so we're very proud of the fact that we can do that. We continue to try to expand family planning services in general. We've had a lot of challenges around that. Reimbursement is not good. We have, such a large number of people that don't have ways for us to get reimbursed. We don't have local funding to do that in very many counties at all anymore. That's something that's really declined precipitously over the past several years, but it's certainly an important public health mission that we're committed to continuing to do.
I think we have enough time to do all of them, so we'll have 3 more. Will you make masks a requirement for public gatherings?
At this time, we've made mask a requirement just for certain occupational settings. So workers in restaurants, for example, or people in close contact professions. We certainly support the use of masks. We've encouraged that at every opportunity. We believe if you're going to be out in public, particularly in areas where you can't maintain a 6-foot distance, you should be wearing a face covering of some time, and that's of some kind. And that's especially true if you're going to be indoors. That's especially true if you're someone who's really susceptible to illness. We have not at this time decided to make that a statewide mandate. There's a great deal of controversy about that throughout the state. As you know, we have many rural communities that don't see a lot of disease transmission that are intensely opposed to that. I think we're all aware that masks have become a partisan issue, which just amazes me. I don't understand how our country got to that point, but whether to wear a mask or not in certain parts of the state is kind of a badge of your political party, and we really think that's a shame. But we strongly encourage people to do that. We're working with local officials all over the state to make sure they understand the amount of disease transmission in their community, and we do want people to wear masks. I didn't plan this, but here's mine, and I keep it in my pocket, and when I go out of my office door, I put it on, and that's what we encourage all people to do.
Let's see. So about 46% of COVID patients are Black. So are other populations being disproportionately impacted as well, or is that the largest population that you're seeing being impacted?
Yeah. People of color are definitely disproportionately impacted. It is, again, not unique to COVID-19. It's just another manifestation of the social determinants that we see with many diseases. Those conditions into which people are born, that are beyond the control of the person, include, the race, the income of the family, the educational level of the family. Unfortunately, children, when they're born in Alabama or anywhere else, have as the strongest predictor of their health their zip code. I mean, that probably matters more than whether they have a physician or not, or whether they have insurance or not. And we hate to make that statement about America where we think everybody has a chance, but some people have a lot more chance than others. And this is another health disparity that we are working to correct. In those states in the United States that have different racial makeups, it's still racial minorities, people of color, whether they're Black or Hispanic or some other racial minority like Native American. Those are the people who are unfortunately bearing a disproportionate brunt of this disease.
Okay, and I think we can do one more. Are there any efforts to expand access to childhood vaccines through partnerships and programs with local pharmacies across the state?
We do have some pilot programs going on with that. That's been an issue that we've worked on for a couple of years. There are many situations where I think that makes a lot of sense. We certainly don't want vaccines to be so widely available that people forego the need to go see a pediatrician. There are a lot of primary care services that are given in a pediatrician's office, and the vaccine sometimes can be the carrot or maybe the stick to get people into the primary care office to get that done. And we certainly don't want to jeopardize that medical home concept. But yet at the same time, Alabama doesn't have as high immunization rates as we would like. And we're looking at a lot of different ways to try to increase that, including partnerships with pharmacies, but also working with other healthcare providers, particularly in rural communities where that's the biggest issue.
Thank you so much. And again, if we didn't get to your question, we're going to try to email out answers to everybody.
Okay.
Thank you
for
so
having
much.
me.
Thank you.
Thank you so much.
Thank you. So, so if we can bring up Kathy Hall. Ms. Hall is the Deputy Commissioner for Program Administration at Alabama Medicaid. Good morning, Ms. Hall, and we appreciate your being here with us today to share an update from Alabama Medicaid. Can you hear me well?
I can. This is Kathy Hall. Can you hear me? Is the sound working?
I can hear you well. Yes, thank you so much.
Perfect.
Yes, yes.
Good. This is my first time to participate on a virtual panel like this, but I would say it's gone extremely well. It's a pleasure to be here with the partners that we work with on almost a daily basis to work on the coverage of healthcare for children. We've got a slide presentation here that just will kind of keep us focused on our discussion, but we can advance the slide. I'm going to give you an overview of Medicaid, and then we'll talk about our budget outlook. And since COVID is the topic that most people are interested in, we will cover some of the changes that the Medicaid program has made to address the COVID issues. Okay, so I want to start by just talking about who we serve. I think many of you know that Medicaid we're a financing agency. We don't provide services, but we work with our partner agencies and healthcare providers to make sure healthcare is provided for the most vulnerable citizens of Alabama. And you can see from this chart that's on your screen that children make up over half of the population served by Medicaid, which is over 500,000 children. There are a little over 1 million Alabama citizens that received healthcare through the Alabama Medicaid program. However, though, you'll note on the chart, as far as expenditures, only about a quarter of our financing is spent on their health care. Our most expensive population is our disabled, blind, and aged population. Okay, now just this is our pie chart we show every year when we go to meet with the legislature and present our budget. But sometimes it's good to just see where the money goes. A majority of our care is spent on institutional care, our nursing homes and our hospitals. That's where a good many of the dollars go. But we also are able to provide pharmacy care, pharmacy benefits, care for all kinds of health services, including physicians, optometric. We have a very good coverage package for our children. We are federally required to cover all medically necessary services that a child might need. So we work very diligently to do that with the dollars that we're appropriated. And this just shows you where the money comes from that the Alabama Medicaid operates its program with. Our general fund appropriation makes up just really the smallest piece of the pie. This was fiscal year 19 numbers. It was $752 million. We receive some other state funds from other state sources like state agencies that we share dollars with from their appropriations. And then our largest piece of the pie is 71% of our budget, which is federal dollars that we receive. And I did want to mention something while we're on this slide. During the COVID crisis, we have received some additional financing from the federal government. They've increased our match rate to where some extra dollars are actually flowing in to help us address the additional services needed during the COVID crisis. Okay, now we'll just talk for a moment about our budget request for 2021. Our general fund allocation is $820 million this year. You'll see that is an increase from our current year. Some of that has to do with some of the financing that we've previously had expired, so we need more state dollars. We were fully funded for the 2021 budget that was approved recently. And the message we'd like for you as our advocates to share with your legislators is how much we appreciate them prioritizing the funds that are needed to serve the Medicaid clients. Now I'd like to get into the response to our COVID-19 crisis that we're facing. And I know we immediately started addressing issues within our agency to address the critical situation that we had with our healthcare system. But one thing I'd like to mention that's very important to know about eligibility, during the time of the emergency and until it ends, this started in March, we have not terminated any individuals from the Medicaid program. So even though someone's circumstances may have changed so that maybe their income changed or some other circumstance that they would not be eligible, they will continue to be eligible for Medicaid benefits during the emergency. And this is expected to be in place until such time as the federal emergency ends. Now we'll get to some of the specifics of things we've done. And this information is on our website. I think maybe I'll mention that a little bit later, but we do have a link to our website that has all of the alerts with specific details of things we've done. We have been immediately started covering the COVID-19 lab testing procedures as they became available to us. There were some new procedure codes we use to identify and pay for those tests, and we have added those for coverage as soon as those became available to us. One of the most significant things we've done is allowing for extended telemedicine coverage during this time frame. We have worked closely with our physician community, with the Medical Association, the Academy of Pediatrics, and the Academy of Family Practice to address the need for telemedicine. And one of those areas that affects children is with what we call our EPSDT screenings, early and periodic screening services. We're allowing for those services to be done via telemedicine, knowing that there will be a follow-up in person for things such as the vaccines and other things that need to be done of a physical nature. But we're allowing for a virtual screening to be done and to pay the pediatricians to do that via telemedicine. There are also some other services that we're allowing, some behavioral health type services that are being performed via telemedicine. And there's specific information on our website about that. We immediately started allowing pharmacies to submit some universal overrides for certain edits and audits that were currently in place. We relaxed signature requirements. And I think this was done across the board by most payers, but when you go to the pharmacy, you don't have to physically sign for the signature. We've waived that during the emergency. We've allowed extensions for the renewal of prior authorization requests for pharmacies and durable medical equipment providers. Here's the next on the list is the recipient signature requirements that we've waived. And then we've also lifted some of the EPSDT screening referral requirements, which normally require a physician to sign off and make a referral. We are waiving that during this time of emergency because we want to make sure services are being provided that are needed. And then with regard to nursing homes, we have relaxed some of the requirements that are done at the time of admission into a nursing home to make it easier for clients to be served immediately and as needed. Another thing we've done is we've waived copay for those clients that are charged a copay. Children, of course, are not charged a copay for the services they received, but for those adults and others that might have a copay for their prescriptions or for their office visit services or hospital services, those are being waived during the time of the emergency. Okay, as far as the effects of COVID, as the emergency continues, Medicaid will continue to adapt in order to ensure providers can deliver health services to all Medicaid recipients. As information is reported, the agency will continue to monitor the full impact of COVID-19 on the state's Medicaid program. We actually will be publishing an alert today to say that we're extending the telemedicine coverage for an additional month until the end of July. We will follow that closely along with the emergency. As the emergency is extended, we'll continue to extend those opportunities. But wanted to go ahead and mention that to you. That should be out there and available to our providers before the end of the day. If you want to stay up to date with Medicaid on our changes that are happening almost on a daily basis, you can go to our website, and that link has been provided to you. And I think that's it for my presentation. I'm available to take questions now.
So did I understand you to say that children have no co-payment requirement for their Medicaid services?
That is correct, under the age of 19. So any child through the age of 18, they are not charged any kind of copay, right?
Okay, is there a movement to move that so that adults beyond 19 would also not have to pay a copay?
That has been done temporarily as a result of the emergency. We've not begun to address those things that have been waived temporarily. That would be an option for the state down the road, but it would be an increase to our budget.
Sure. Okay. Thank you. Let's move to Olivia. Olivia, I saw some questions. You have 2 or 3 maybe?
Yes. So does the term no losing Medicaid rule apply to those who are no longer SSI eligible, which is a federal determination?
It does apply to them. They will not lose their eligibility. They might lose their SSI, but they will not lose their Medicaid. That's an excellent question.
And as it relates to DME, what specific provisions have been made to cover respiratory equipment to people needing oxygen, etc.?
Well, we already cover that for children and adults. So I'm not aware that we had to add anything new for any of that type of equipment. But we would cover what was needed if we had clients needing that.
I think I've got 2 more for you.
Okay.
How will Alabama respond to increase in applicants due to new eligibility from the COVID-19 impact?
Well, I know we have been asked by reporters and others of what's the impact of applications. At this point, we're not seeing an unusual increase in applications for Medicaid. And perhaps that's because we've not terminated, but we have not seen a surge in applications. But we will continue to monitor, and it all ties then to our budget of whether we'll be able to make it through the next year or so with an increase in numbers. That's something we watch almost daily. We've got our analytics unit monitoring it, our eligibility unit, and our finance director is monitoring that closely.
And my last one for you, will Alabama expand Medicaid to save rural hospitals and individuals without health insurance?
Unfortunately, that's not a question I can answer. And I'm not even sure our Medicaid commissioner can answer that. That's something that will be a consideration by the collectively with the governor and the legislature and others. So, but unfortunately, I can't answer that today.
Yes, ma'am.
Mm-hmm.
That's all I've got for you. Thank you so much again. And again, if anybody has questions, we'll get to them through email if you missed them.
Okay, thank you.
Thank you.
Yes, this is Charles Nash on that last one, not a question, but a comment. Someone says, so hope Alabama will soon expand Medicaid. We heard your answer. Thank you, Ms. Hall. We really appreciate you being here today. Good luck in all your work for the people of Alabama.
Thank you.
Thanks. Okay, our last presentation today in our panel is from the Alabama Department of Mental Health, and Ms. Lynn Bashir, the commissioner there, will be joining us for that presentation, questions and discussion. Good. Is it still morning? It is. It's still morning. Good morning, Ms. Bashir.
Barely. Yes, thank you. Good morning. Can you hear me all right?
I hear you very well. Yes, thank you very much. We look forward to your presentation. Thank you. We'll about 15 minutes, and then we'll see if there are questions and discussion.
okay? Well, first of all, let me say how much I appreciate the opportunity to be on this call and to talk about what we believe is the most important investment that Alabama can make, and that's our children. And everybody on this call, I'm sure, fully agrees with that. The mission of our department is to serve, empower, and support individuals with mental illness, substance abuse disorder, and developmental disabilities. And we do that through our 3 hospitals, which are in Tuscaloosa. We have the Harper Center, which is sort of a nursing home-like facility for people 65 and older. We have Taylor Hardin Secure Medical Facility, which is for individuals coming to us through the court system for evaluation for not guilty by reason of insanity. And then, of course, we have Bryce Hospital, what we call New Bryce, which opened a few years ago with 268 beds. And then we contract with over 300 providers statewide to provide services to approximately 150,000 individuals through residential facilities, outpatient therapy, and then a broad spectrum of other mental health services. So I wanted to spend a little bit of time. This is my only slide. And this is a graphic that we call our pillars of mental health. And these are all the things that are needed to have a sustainable, successful, coordinated system of mental health care, we believe. And I want to talk for a minute about the one on the left, the prevention one. All of us understand that intervening early and proactively is usually the most effective strategy in all aspects of life, whether it's removing a nail from a tire to prevent a blowout, to treating the common cold to avoid it becoming pneumonia, to the nurture and education of a child from birth to be able to grow into a successful adult. In all 3 examples, we're going to end up with a better outcome and the unnecessary expenditure of money and the avoidance of other negative outcomes. Now, Alabama is home to about 160,000 infants and toddlers, and more than 26% of them, that's over a fourth, have 2 or more adverse childhood experiences. To address these children in need, we have a close partnership, as you heard earlier, with the Department of Early Childhood Education. And our department actually hired 5 state-funded regional infant and early childhood mental health consultants. Evidence shows that investing in developmental growth of at-risk children from birth yields a return of $13 for every dollar invested. It is not a secret to anybody on this meeting today that from the time a child is born, their brains develop in response to interactions with their environment. Stress, neglect, and abuse can permanently damage a child's cognitive ability. Children with little or no stimulation to the brain causes their neural pathways to wither and die. And so the tragic reality is that some individuals, through no fault of their own, are destined to not be able to successfully participate in life. Indeed, we see this every day in our nation's prisons. The physiologic reality is that after a certain point in time, these deficits are almost impossible to make up. At the Department of Mental Health, we provide programs specifically for children and adolescents, which, thanks to additional funding from the governor and legislature, we are expanding to reach even more children. And a good example of that is our school-based mental health collaboration. And Dr. Boyd was on earlier from the Department of Education. This grew out of the Sandy Hook tragedy and has now expanded to 65 out of 137 school systems in the state, in collaboration with 16 of our 19 community mental health centers. And we are so pleased that for the 21 budget, we're going to receive an additional $750,000 to add an additional 15 program sites. The school-based mental health collaboration provides the services for children and adolescents in both general and special education with on-site services at school. Students needing this level of service are identified through a collaborative process among teachers, administrators, and parents. And we refer to these services as Tier 3. They focus on treatment, prevention, and early intervention by a master's level mental health professional who's an employee of one of our mental health centers. And this allows for the services to be billed through the mental health center. The integration of mental health services in the school fosters continuity of care by connecting students to additional services like an in-home team. These services can ensure sustained gains in academics and the overall development of students while supporting their families. It also saves hundreds of hours of lost classroom instruction, and it saves parents the benefit of not having to leave work. There are a number of goals around that. Improve student and family engagement, increased number of students receiving mental health services, increased hours of services provided, and ultimately academic and social success in school. The Department of Education has additional goals that are increased rates of attendance, less unexcused absences, less out-of-school suspensions, fewer delinquent behaviors, and of course, a lower rate of arrest and an improved graduation rate. All of these goals are win-wins for students, families, and communities throughout the state. Another part of our department's outreach to children is through the Office of Prevention Services. Prevention services meet the needs of individuals across the lifespan, but focus at this time on school-aged youth through contracts with providers in all 67 counties. Evidence-based curricula are offered at local school systems with activities to affect critical life and social skills, including decision-making, refusal skills, and critical analysis of media messages. In addition, prevention providers partner with after-school programs to provide alternative activities that exclude alcohol, tobacco, and drugs. Thankfully, despite the COVID pandemic, we were able to receive funding for our top budget priorities in 21. Governor Ivey delivered budgets to the legislature in February that included the largest increases for the Department of Mental Health since Lurleen Wallace was the governor. And despite COVID-19, the legislature supported her recommendations. Between the Education Trust Fund and the General Fund, we expect to receive about $26 million increase this year. Our largest increase is going to be $18 million targeted for crisis diversion centers. We hope to stand up 3 of those, and I'm going to share a little bit more detail about that in a minute. But I wanted to talk for a moment about our challenges. As our current year's budget related to the unexpected expense of COVID-19, purchasing necessary PPE has become a priority. We have, as I said a moment ago, 3 hospitals. We have to make sure that the patients and the staff have the proper PPE. In addition to that, we have provided a hazard pay increase for our hospital employees during this time. And neither of these, of course, were in our current budget. Also, when COVID-19 came to the state, the department immediately closed our 3 hospitals to visitors and new admissions. We believe that our first obligation is to our current patients. But we know that there's still a need for additional patients to be received for mental hospital level of care. And so we stood up 4 alternative sites with beds around the state to receive patients that are referred to us from hospitals and through the court system. We, of course, immediately implemented CDC best practices and guidelines for our developmental disability providers and our mental health centers that are in the community. Patient and staff safety continue to be our primary focus as we provide mental health services. Working with providers, we determined that their best course of action related to their services, and fortunately, many of them were able to successfully move to online and digital mental health services. And a really good example of that came to us recently from Wellstone Mental Health, where the feedback that they are receiving from their older patients is that they really prefer telehealth. It saves them from having to travel, and it's just more convenient, and they are pleased with the quality of the care. So we are not sure what the future holds on that as far as payment, but for now it is working well. But I'm sorry to say that that success is not universal across the state. And just as providing academic services to rural students due to lack of broadband, we heard Dr. Boyd speak about that earlier, it's a major problem for us in providing mental health services to the kids that we were seeing in school who do not have access to broadband. Individuals, also adults, teens who use their cell phones for everything do not want to use their limited minutes for mental health services. So that is presenting a problem to them and to us. Now let's talk about crisis care that I mentioned a moment ago. And that is the second pillar there on the graphic. We want everybody to know that the work to establish a system of mental health crisis care is ongoing. It has not stopped. The methodology has changed from in-person meetings to many Zoom meetings and phone calls, but despite the barriers, it is going on. It has been documented from mental health work in other states over recent years that systems of crisis services have emerged as one of the most effective tools within the larger system of healthcare to improve the lives of people struggling with mental illness and substance abuse issues. It has reduced bookings into jail. It has reduced ER admissions that are unnecessary, and it has saved millions of dollars, with, of course, the most important outcome being that individuals get the care and social supports they need to move towards stability and recovery. The COVID situation has actually afforded us an opportunity in working with our mental health centers as they are going through this application process for one of 3 grants. It has afforded us an opportunity to work more closely with them. So we are trying to maximize what we can there. In a joint legislative press conference that I was invited to participate in February, it was stated that the investment of $18 million new dollars to our department that is being made is the first step to build a broad system of crisis care in the state. We did not get into this current situation overnight, and it is going to take time to turn this ship around. So I want people to have realistic expectations about this and to join with us in partnership at the community level to make this successful. We want to assure you that we are fully committed to this task. You will be interested to know that our approach in Alabama is unique in that we are proactively moving in this direction. So many states, we have learned, have had to come to this through a Department of Justice lawsuit. And we are very fortunate that after only 2 years, our Stepping Up initiative has already provided the framework of relationships among mental health providers, law enforcement, courts, social service providers, hospitals, elected officials, and community leaders that further strengthen communities and that will be needed for a crisis center to work. Now, in addition to the funding for the three regional crisis centers, early in the 2020 session, the legislature designated funds to implement 5 rural crisis care centers. And we are working closely with them to get that off the ground. They are going to be, that's already been identified, and that's Coleman, Wellstone, Northwest Mental Health, Cahaba, Southwest Mental Health, and West Alabama. And most likely they will consist of mobile crisis teams rather than a specific site where people will be taken. There will be a team that goes out to where people are, but that's being worked on still. So here's our department's message to lawmakers, and we certainly appreciate your willingness to be our voice in this as well, is continue investing and supporting all mental health care services that saves lives and truly make a significant impact on the quality of life in all Alabama communities. In closing, let me just say, I appreciate the opportunity to speak today about our preventative and crisis care services. Our hope is that you will share this information with your friends, families, coworkers. It goes a long way in breaking down the stigma, the wall of stigma. And that is our number one barrier to care. I will say that if there's one positive thing that has emerged from the COVID situation, it is the very open conversations that people are having around mental health, their own and everyone else's. So we hope to be able to build on that level of conversation. What we have seen is that all of us need other human beings literally to survive, both physically and mentally and emotionally. And so I want to wind up my comments there. I think I may have used all my time, and welcome questions at this point. So thank you for this opportunity.
Sharing what the department is doing and is looking forward to doing. So I have just one quick question. I think it's a quick one. Is there a number which is readily available for the percentage of mental illness that's attributable to substance abuse?
Yeah, there's a national hotline. Okay. Here's what people need to do. Go on our website, and there are numbers and resources there. Absolutely.
Okay.
Thank you for that question. I should have mentioned that. There is a tremendous amount of information on our website. We have information dedicated to COVID, but we also have information completely dedicated to mental illness, substance abuse, children's services, mental health centers, developmental disabilities information. Yes, sir.
Good. Thank you very much. I heard on a National Public Radio presentation yesterday, I believe it was, that, and let's see if I can get this right, that being without people in your environment, people who are locked in because they are living alone for 10 days is equivalent almost of the impact that it would have on a person for not having food for 10 days in terms of the impact on their mental awareness. Yes. I think I have that right.
Yeah.
Yeah.
Well, that is really disturbing, isn't it? But that is the reality. And we have heard on television about individuals dying in a nursing home of loneliness, where their family can't get to them. It just, it is stunning. And so we are going to hope to maximize this opportunity where people are now feeling much more free to speak about their mental and emotional health.
And all of that affects our adult population, of course, affects our children. And that's where our focus is today.
Yes.
Okay, let's see if Olivia had, I'm sorry. We're having a little bit of a delay here, so we're talking over each other a little bit. Let's see if Olivia has a question or two from our chat box, Ms. Brashear. Olivia?
So I have a couple for you. So the first one that we got was what amount of CARES dollars is going towards the mental health in schools?
Okay, in schools. You know, I guess that the State Department of Education would have to answer that. Our department from the beginning, we understood that we were going to have to do very meticulous record keeping, and we have reached out to our community providers and said exactly, we need invoices. We don't need anecdotes. We need invoices of what you have spent. Of course, we're keeping up with what we're spending in our hospitals and our mental health centers. And so we are working very closely. We have some great people in our department that have very strong working relationships with the budget office and the governor's office. And so we are working closely with them to document what our expenses are so that we can draw down that money for us. But as far as the schools, Dr. Boyd or Dr. Mackey would have to answer that.
Yes, ma'am. The next one we have is with much accessible data supporting the importance of the early years. How are mental health services and interventions being implemented and directly delivered to the birth to 4 sector of education, including the early care education workforce?
Okay, that is a wonderful question. And we've got 2 experts that I would love to refer this question to for an in-depth answer.
Yeah.
We do in-home consulting, I can tell you that, and a lot of training of parents and teachers, but that's the 30,000-foot view. So Jane Dewar, D-U-E-R, and Dallas Rabig are the 2 individuals who can give you all of that information. Let's see, what would be the best way for me to get their contact information to you?
Probably just through email.
Okay.
You can get it to me or any of the.
Why don't you send me an email with that question and I'll reply to you.
I got it.
Okay. You got my email address, lynn.bashir. Yeah. Okay. Great questions. Thank you so much. We want to get the word out.
And then we've got, I think we have time we'll do one more. What infrastructure is being laid to bridge the gaps in virtual technologies? Are there partnerships with data providers to make room for mental health services in their plans?
You know, that's a really good question. And you heard Kathy Hall a moment ago, and I was so pleased to hear her affirm that we're going to get paid. Those are going to be available through the end of July. We believe it's successful. We are seeing it successful. We know it's not going to work for everyone, and it's going to require a lot of gathering of information and data and figuring out how we're going to work in this new normal, because we don't know how long. You know, we keep hearing about a second wave that could come, and it may be that these telehealth opportunities will be extended on. But just know that we are doing the work on our end to try to be ready, at least whenever that opportunity presents itself.
I think that's all I've got time for. Thank you so much, again. I will email you that question.
Great, and I'll get that email, that information to you. I don't want to broadcast these people's email address.
Yes, ma'am.
You know, we'll make sure it gets directed to the people who need that.
Yes, ma'am. Thank you so much.
Thank you. Thank you.
Okay, thank you, Commissioner. We appreciate you very much. And thank you for the work that you and your department do for the people of Alabama. Thank you, Olivia. That concludes our panel presentations and discussions with them. On behalf of the 500 or so child advocates who registered for this event today. Thanks to all of our panelists. And on behalf of the more than 1,100,000 children under age 18 in our state, we thank you for your ongoing work for our children and for your abiding interest in their well-being. Take good care, panelists, and all of us. Never grow weary of doing good for our children and their families. Back to you, Stephen, for the wrap-up and what's next.
Thank you so very much, Dr. Nash, for facilitating that panel conversation. And thank you to Dr. Boyd, Commissioner Buckner, Dr. Smith and Strichik, and Dr. Harris, Ms. Hall, and Commissioner Bashir from the state agencies that work directly with our kids. There is so much that gets done at the local level, at the grassroots level by these agencies and their employees across the state. All 67 counties are provided services, and so many of the services that our communities need are provided by these agencies. We appreciate all of you taking the time to speak to the advocates, and we appreciate all of the advocates for joining us today. We wanted to do a couple things. First and foremost, thank you for joining us. Please know that our advocacy at Voices is changing, and I think will be changing for the foreseeable future to a more virtual platform. To that end, we are working on a plan to host monthly webinars similar to this on specific topics. I believe we're going to post a poll that if that is something that you would be interested in participating in, please click yes so we can get a sense, so that we can identify specific topics including mental health, childcare, food insolvency, a number of things that we recognize are crucial issues identified in our Kids Count data that we can work on doing a deeper dive into the nuances and the details of the challenges we face and the options and to address those challenges. One of the things we wanted to leave today with is how can you help us? We did not and will not charge for these events. Voices, as every other nonprofit in the state, has struggled financially over the last 3 months because of COVID. And so we want to give you the opportunity to commit to supporting Voices. Our supporters allow us to provide webinars, events, advocacy training, and more at no cost. And so we are making an ask that you consider supporting us through a variety of ways, and this is a financial ask. We ask that you donate. We can do it recurring donations. We can do in memorials or honors. We can take donations via the web, by phone, or by mail. And recently we've created the ability to donate stock if that is something. We are not funded by federal dollars. We are not funded by state agencies. We work closely with them and provide services to them at times, but we are a standalone 501c3 that is fully dependent on the support of our donors. So please consider making a donation today. And then there are other ways you can involve yourself and participate as well. If you are not a member of our Voices Child Advocacy Network, please sign up. You can go to our website and sign up today. And you will get recurrent monthly or weekly emails from us, and they are a variety of topics, calls to action. Sometimes throughout the legislative session, we'll be pushing weekly emails out about what's going on in the legislature that directly impacts kids. Engage with us in social media. If you are not following us on Facebook or Twitter or Instagram, please do. We'll have links to those on our website as well. We also are a membership organization. If your business, your association, your nonprofit is not a member, we encourage you to explore membership. There are benefits for membership, but it's also a way that as an organization you can support us. And then read our publication. Mr. Poole and Mr. Orr both referenced our documents, and they are, as he said, voluminous. This is our county profiles. There's 240 pages of data based on, at the county level, of all the indicators we track, and then our Kids Count data book. For 28 years, we've produced the Alabama Kids Count data book, which tracks our data based on county, and we track over 70 indicators, the health, economic security, safety, and educational attainment of our kids at the state level and at the county level. That is the data that we base all of our advocacy on. All of that information is available for free on our website, so please visit alavoices.org and dig into that. We thank you for participating today. We hope that this has been useful and valuable to you. We recognize that this is not our typical facility. This is not the way we normally do this. Normally it's a breakfast and then we go and visit the legislators in the State House. We felt that this was the most effective way we could share this information with you in this time. Let me again thank Senator Orr and Representative Poole. Let me thank Dr. Nash and then all of the state agency directors that joined us today to share this information. If you asked questions in the chat and we were not able to get to those questions, please know that we will be sharing those back out to the state departments. You will be getting a link to this recording by the close of business today is our hope, that will allow you to go back and review it. And we encourage you to share that. This will be something that you can share with others in your circle. Remember that there is no advocacy if there are no advocates. So thank you for all that you do. Thank you for your willingness to learn, to inform yourself, and then to speak up on behalf of Alabama's children. One of our strongest lines is powerless voices need powerful advocates. So we need to make sure that our advocates are speaking out on behalf of the kids, the issues that matter. So thank you all so much for today, for joining us, and we wish you safety and health in all of your communities.